All right. So today on the MTB Performance Project, we've got co-founder of Resilient Performance Physical Therapy, Greg Spatz. Greg, good to have you today. Thank you
Great to
for,
be here. This is
yeah,
awesome. I'm glad we're in the same room because
yeah,
these are sometimes weird over Zoom when there's like a delay, but this
yeah.
is more enjoyable.
No, definitely a little bit adds to the vibe, I think. So, cool. Before we kind of get into our conversation, tell us a little bit about yourself and your company, Resilient Performance Physical Therapy.
Yeah, so Resilient Performance Physical Therapy, we started, myself, Trevor Rappa, and Doug Kachija are my two partners. We started Resilient in 2015. All three of us met in physical therapy school, and at that point in time, we had all had some sort of background in strength and conditioning, whether it was working. I worked for the Arizona Diamondbacks for a couple of years before physical therapy school. Trevor worked at Mike Boyle's and also at another gym back home in Illinois where he grew up. And then Doug Kachijan had done, you know, extensive education through getting a master's and different strength and conditioning internships for a long time. And we all kind of gelled around that because not a lot of physical therapy students had that kind of common interest or background, which, now anytime we have students come to us asking for any sort of guidance, we're always recommending that they do internships at places like the Annex or anywhere else that they can provide kind of the next level or the kind of modern approach, hybrid approach to physical therapy that just turns into good training. So that's kind of what Resilient is founded on, is how do we get people back to doing higher level things than just your like quote unquote rehab exercises or low level exercises that you would see if you just kind of Google physical therapy on Google image search or whatever. So yeah, and then at this point in time, we've been at the Annex with Mickey and his team since 2017,
Yep.
October 2017.
Yep.
Going on, so just over 6 years now. And it's been the best thing for Resilient moving into New Jersey. We were originally just in Manhattan, so we grew coming out here. And then myself in particular, like I'm almost only working with baseball players at this point in time. I'll kind of get a little, random non-baseball player here or there, or the parent of a baseball player who kind of, they want to kind of learn more and help themselves a little bit too. So yeah, that's kind of my focus is baseball and baseball rehab and how to give the Annex, kind of like a clean slate, give you somebody who's ready to have a bunch of training put on top of them and be successful in the short and long term. And that's our goal.
Yeah, I think that's what makes you guys in particular very unique from any other physical therapy clinicians that I've worked with in the past, is that you all have like a heavily influenced background of strength and conditioning. Like you did something in that capacity before you went to PT school.
Right.
So I think there's, just like as a strength coach kind of needs some understanding of what you guys are doing to kind of collaborate, I think good PTs understand where good training fits into that return to sport or return to play protocol. And I think you guys do a really good job of blending that. And I think especially towards the end of like a return to play, like that's something you guys, I think, do better than anybody else. Obviously, we see it firsthand. And I think most importantly, like we see the level of like where the athletes are when they're ready to be handed over. When they're in that part of their process, whether it's, post-op care or just coming back from an injury, once they're ready to start training, they're often very well equipped to handle any type of stress that we throw at them.
Yeah, and that's our goal, and that's what makes your job easy or easier, and it makes our job easier knowing that they're going to a place that they're going to get what they need from a strength and conditioning standpoint, because there is that kind of enormous gray area between surgery and then being on a field again, or being on a mound, and that's we try and fill that gray area as much as we can, and then kind of quarterback the transition as best we can, because all of our time is one-on-one, which makes it we have that luxury, so it makes it easier for us to have that one-on-one control, if you will, of somebody's return. And then it's great where we can kind of clear people, or clear these athletes to be doing certain things, and then just let them run with you guys, and we don't have to worry about it.
Yeah. And it's something that like it's always helpful for us because through our assessment process, sometimes we run into issues with athletes who encounter pain in some of the like the testing we're doing, and
I think it's more common than not. Yeah.
yeah, it's really but it's so nice to be able to, real time just walk in your office and say, hey, can we set something up with this individual athlete?
Yeah.
Post assessment, I have some concerns. I'd like you to just clear them, and so it's good to have that. But
yeah, and it's good that you can then like you don't have to then stop your entire process. Like you can there's still things that you're going to do whether or not that person then sees us in 2 weeks, 3 weeks, 4 weeks, whatever. Like you're still going to train them, which is the ultimate goal, is that they're doing that, and that's why they're here. And then it's a matter of like how do we then facilitate anything that they're missing or lacking or deal with some sort of pain situation that you then don't have to worry about kind of navigating around it at all.
Yeah. And so that kind of leads me into my first question is like we collaborate in a lot of different capacities here, whether it's, I think we're always aiming to achieve like a holistic approach between our services or efforts and your efforts, right, with athletes. I think sometimes it comes to us by way of like post-op care, and athletes, unfortunately, through that experience start to understand the importance of, integrating, manual therapy, PT, and strength and conditioning, and all those things kind of in between.
Right.
So those are kind of generally the scenarios that we work together with. Tell us why, like, you think that's something that's so important in the developmental process with athletes, and why that, like, to you and to us, why that really matters.
Yeah. So, and we can bring it all the way back to like a 30,000 foot view of like, what are they even coming in this building for? And, we know in our heads, it's like, okay, we want to develop some sort of resilience. We could, we'll use that word, which it's so funny watching like Texas Rangers just won the World Series, and the word resilient is thrown around all over the time, all over the place. And I'm like, I love it.
Catchphrase.
Great. Yeah. But, we're trying to make resilient athletes that can perform day in, day out and do what their coaches expect of them. And sometimes it might be too much for them. And then we're here to kind of put out some fires and deal with some things. So whether they're training in season, out of season with you guys, or they're kind of just getting touch-up maintenance work with us throughout the year, like having everybody on the same page and somebody to kind of cover all those bases, because is huge for us. Because there will be situations where, we'll have an athlete that we're working with who, maybe they return. There's pressures from other people besides us. So there's pressures from coaches who we might not have good relationships with or any relationships with, who maybe a lot of times we'll hear the coaches like, well, if you're not 100%, then you're not playing at all. So then we have to kind of navigate this whole team approach of like, okay, how can you guys stress them from the training side in the gym, on the turf, with any lifting stuff that is then trying to train them, stress them enough so that they can adapt and be 100% so that they can then get on the field with that coach. Then there's other coaches that might kind of gel with our approach of like, well, if you're not 100%, that's okay. There's still plenty of stuff you can do, from individual stuff, low load stuff, low stress things that you can do, whether it's in here or with a coach, a skilled coach elsewhere. And that's an ideal situation, because we're not going to replicate in the gym or in our physical therapy room. We're not going to come close to the realities of what athletes are dealing with on the field. So it's almost like we're contingency plans for when things go wrong. And that kind of goes back to the original thing, bringing it up with how we kind of work together a lot. Oftentimes it's because people break, and that's why they wind up in my office. Unfortunate. It's going to happen. So I'm glad that I'm here to kind of offer that help for these athletes. Obviously, it's not something I wish upon anybody, but it's going to happen. Most athletes let's say throwing athletes have some sort of elbow or shoulder pain at some point every year. And for some reason, the number like 75% is sticking out in my head of athletes who are in season and have elbow pain actively.
Yeah, it's probably pretty high.
Yeah, it's extremely high. And, you're seeing it more and more with injuries happening more and ligaments being torn. And now there's, position players it's happening more with, and it's everybody's like, why is it happening? And there's definitely fingers can be pointed in different directions of why these things are happening. And I have my theories. I'm sure you have yours, and we're probably actually thinking the same things. But having the team approach of putting people back together from a post-op situation, as well as kind of the reverse where they are performing and it's like, okay, they're just kind of a little banged up. They were probably asked to do maybe a little bit too much, or whatever happened, that I can help facilitate putting out some fires so that they can then go back to something like training and performing on the field without having to really worry. I don't know if I think I kind of answered your question.
Yeah.
I'm not sure, but
Yeah, I mean, I think the most important distinction that I think often people get tripped up is, well, if I'm not injured, I don't need to go see a physical therapist. And so I think that's the most common distinction that I think is important for people to understand, is that, they can utilize guys like you and your team when they don't have to be injured, quote unquote injured, or have some type of like something wrong with them. And I think that's the most important thing, is to get people to understand that that's part of that holistic approach from a preventative standpoint, is like we're trying to stay ahead of those things, right? We're trying to avoid those types of like things getting to a certain point of like threshold where now, whatever was dysfunction now is becoming injury. So if we can hedge that risk by utilizing, strength and conditioning and, the stuff that you guys are doing from a maintenance and soft tissue standpoint, like I think that's a really powerful tool that, I think the reason why we collaborate and do so much together is like we're trying to create a scenario that is similar to that of like a professional organization, right?
Yeah, and to give you an analogy, like, it's kind of like an all or none. A lot of times people think it's like I'm either off the shelf, I'm hurt, I'm on the shelf, so I need PT, or I'm not, and I'm totally good. I'd say it's like the same from like a strength and conditioning standpoint, where it's like a lot of these athletes don't think they really need to do anything because they're in season, and we all know that's not the case. That's not ideal from our standpoint of keeping these people on the field feeling good, kind of keeping them where they need to be so that they can keep performing and they don't need fires put out by someone like me. Because I know you guys, like, you have different in-season programming that you'll recommend athletes do, and I think that's something that is changing in like our the younger ages, with club baseball kind of taking over and taking a lot of time away from doing other things to kind of keep them feeling good from weekend to weekend over the summer. But I think it is changing a little bit, where people are seeing the value in what you guys are doing even in season, because it's not just like all or nothing. It's not just like, oh, well, I'm just going to go get jacked in the winter and then I never have to touch weight until next winter. Like, that's just not best practice. And, it's at the highest levels, that's not happening. And that's their job. And if it's to keep them on the field, there's a different focus from the strength and conditioning standpoint. Like, you're not just going to crush people in the weight room, and you'd be doing a very bad job, and people wouldn't be here if you were doing that. So it's the same situation. It's just a different profession. And there's definitely things that throwers and kind of, I wouldn't say like need, like you can go an entire year and you're 16, 17, and like you could be fine and you could never need someone like me. And that's the hope. But I do think that there are some low-hanging fruit sort of approach things that you and I both will see on an evaluation with an athlete, whether it's missing range of motion in certain movements, or just like strength deficits or whatever you might find on like performance assessment. There's definitely things that are missing from like shoulder rotation is like number one thing that I'm trying to kind of make sure everybody has, because I do feel like that is a number one kind of contributor to elbow issues, right? And shoulder issues too. Makes sense. So that's something where they might not even know that they have these limitations or strength deficits until they go through an assessment, because they're only 16 and like you can kind of get away with things for a little bit longer, and maybe you don't even throw hard enough to hurt yourself yet, or like there's a lot of different factors there. And I do think people kind of just think it's like an injury situation, as opposed to like your performance can actually improve too. Like, there's research on how much external rotation or horizontal abduction your shoulder needs or has, and what your velocity looks like. And chasing velocity is a whole other thing that we could probably talk in a separate hour about. But there's definitely things that can be improved from a performance standpoint, where you could perform better and better every weekend throughout a summer if you are doing certain things in the middle of the week, whether it's from a strength and conditioning standpoint or from sort of like a maintenance or movement focused standpoint with someone like myself.
Yeah. Yeah. And I think that's important for athletes to understand that like what we're doing is dependent upon the time of year. Like in the off season, we're trying to build athletes up and create, as you said, get them as resilient and robust as possible. Um, in the, in season, in the in season, in season protocol is more or less just, hey, let's try to maintain so that we're, all that work we do in the off season, we're maintaining that. And then, once they get through their season, if they stay healthy, which is the goal, then at the end of that season, they start another off season and they kind of pick up where they left off, and if they don't, then they just kind of go right back to where they started from in the beginning. So then they don't get to reap the compounding effects of development
And I do think
stuff.
I think people sometimes think the stuff that you do, even in like the winter, in the strength, like those building up phases, like I think people sometimes like think they know what that looks like too, and they don't really know that what you guys are doing here is different than what they might not, what they might do on their own at the YMCA or with a different strength and conditioning facility that doesn't kind of deal with baseball players as much. But whether it's baseball or not, another sport, like I think what you guys are doing here is just a notch above, and it can be simple. It can be simple. I think you keep it simple, but it's not. It shouldn't be. It's not, or it's basic or simple or whatever you want to, whatever word people use. It doesn't mean it's easy or it's dumbed down and you can just like pull it off the internet and just start doing back squats 3 days a week or whatever, like I did in college, and that didn't work out. It's it's more. It is a little bit more complicated than what people think it is, and I think oftentimes people visualize certain things are being done in this facility that aren't, because we just don't value what those things are, and we don't need to talk about specifics in general. It's just I think that's enough.
Yeah, and I think the biggest importance is understanding like what we're doing is rooted in science, and like we're trying to like produce specific physiological and movement outcomes with athletes. And that's, based off of research. It's based off of, years and years of experience of, what's worked and creating iterations on previous years of off seasons. But
and some of it might just be actually really simple. Like, like this kid just needs some mass, and like that's what they need right now at this point in time. And those are the easier things to do, other than getting teenagers to eat a lot of food is sometimes challenging. That might be the hardest part. The lifting of the weights at that point in time is kind of the easiest thing, but then it's like, how does that change year over year? Because we've got a room out there full of minor league baseball players, and it's like they are not the same that they were 5 years ago when they started training here, however many years ago. So it's if you did for them what you did 5 years ago, it wouldn't be useful for them, or as useful. So it changes.
Because they're evolving, and their bodies are changing. So we've kind of talked about the two different scenarios through which we're collaborating, post-op, post-injury, whatever you want to call it, and then also from like a preventative, holistic approach. Giving those two approaches, like, why do you think? And I think this kind of gets into where, like, having two separate entities, right? Like maybe an athlete goes to a physical therapy clinic and then they go train with somebody. And that's not to say those two parties can't collaborate well. We've kind of seen challenges with those scenarios, but talk a little bit about how, like, we feel like, or you feel like we've been able to create that team approach here that at the end of the day is, most importantly, is rubbing off on the athletes and giving them more value.
Yeah, I mean, number one is that we're under the same building, like we're under the same roof in the same building, and like I could just walk out my door and find Damien, find you, talk to whoever, whatever coach is involved with the athlete that I'm working with, and I can make changes to their program on the fly that day if something, if there is a fire that needs to be put out, and it's like, all right, they just need to kind of avoid something vertical for today, so we're just focus on this, and I can easily just make that recommendation. or give alternatives to certain exercises that's on their program. They could just pull from the program wall, whatever, with all the sheets. They can pull their program out, and I can even just tell them like, don't do this one today, and then they can even communicate that to Damien, or you, and that's more so for some of the more mature athletes. I might let them do that, but otherwise, I'm trying to find the coach that's handling them and make my recommendation for either that day or like the next week or two before I can reassess and see where they're at that point in time. And then that would be more so like the on the fly decision making is more so with the putting out fires type of approach, as opposed to, for me, it's super helpful to have somebody, when I have somebody post op and they train here with you guys, from week to week, I can go through an entire rehab process while having you guys piggyback on just kind of more general stuff, general strength and conditioning, and then also give you recommendations on, we're not going to deadlift this kid yet. It's too soon. He just had Tommy John. So that's something that I want to start with them, and I can kind of have like my rules or my, like I want to take on the risk of, I want to be the first one to deadlift with this kid. So after that, then I want you to take it and use this approach, and I can give you guys kind of like loading parameters that are specific to that injury and that kid. And those are things that I don't think are kind of like happening from a day to day, like every day in a lot of different places. And at the same time, we get to certain points, like we worked with so many athletes from both ends of that spectrum of putting out fires to post-op, that I could even, if I say something to you, you already know what I'm going to tell you to do next week, or what loading parameters I'm probably going to recommend. Like, you probably already know, and without me, you'd probably already be doing that stuff too. So it's more of like we're all kind of covering each other. I just, from a post-op standpoint, might be, or even kind of a putting out fire standpoint, I might be the one that in that moment is kind of taking on like the quarterback role, and I'm the one that's going to say like, and dictate, don't do this or don't do that, or do this or do that. And then that's not the goal, is that that stays with me. That should be something that I can then over time just strip away and say, okay, this kid's been deadlifting, like you guys do that now. I don't want control of that anymore, and I've taken on that initial risk, and it's no longer a medical situation really. And that's what the distinction is between the two of us really, is like, I'm more medical and I just did more school than you. So then I can legally do things that you can't.
Yeah.
But at the same time, you can probably still do them competently even without me. But that's the good thing about having us in the same room, is like we have so much overlap that like nobody's falling through the cracks. That's like that's our goal, right? So that's the huge benefit, I think, of having us under the same roof and that team approach. And like we kind of started with too, like you have enough of a knowledge of regressions to strength and conditioning, and I have enough knowledge on progressions to rehab into the strength and conditioning realm that we really don't think we're going to miss a lot of stuff.
Yeah, and I think that real-time scenario is what's so important. Like you had said, putting out fires, or and that's more or less like the day-to-day stuff. But I think especially in like the post-op care is, I would argue, like early stages, there's a lot of stuff that you're going to be heavily influencing what that athlete's doing on a day-to-day basis.
Yeah, and most of the time, it's like they're probably not going to be like training for a few weeks, and that's fine. And then it'll be slowly kind of like, okay, get this kid back and work with you guys.
And then I would, like, as their time with you increases, like there's more important, like higher leverage things that only you can do, that having the ability, if you're spending an hour with a kid, like there's only so much you can fit in that hour. Mm-hmm. But as they're capable of starting to like do some more like higher level training, loading and things like that, it's easier for you to just say like, hey, I'm gonna continue to do like the stuff that I need to do, or in stuff that you need to do.
Right, like when plyometrics begin, that's going to begin with me, and you would have already been doing all the strength work with them for weeks at that point.
Yeah.
Yeah.
And then as they start throwing, like those are things that you're going to be typically doing, but then like that's taking time away from other things. So having the ability to kind of punt those things over to us, and understanding that those things are going to be executed upon properly, and nothing's going to fall through the cracks. There's not going to be any like lack of communication. Because I think a lot of times, from my experience, like again, you can kind of collaborate with other PTs, but the risk variability of missing a day of communication, or, like, oh, well, I'm just going to err on the side of caution or not,
Right.
and do this with an athlete where, maybe like, like just the other day, there was a scenario where I'd ask you about a certain kid, like, hey, what are we going to do here? Like, give me an update. Where are we? And I mean, that was a 5-minute conversation that, I mean, it didn't take a phone call, like
Right.
phone tag, email, back and forth, less than 24 hours. It was 5 minutes and it was done.
Yeah, I mean, we're all busy. Everybody's
Yeah.
busy, whether
But
you're here or not. Like every professional is
Yeah.
busy,
And so
have
that's-
family lives as well. And
yeah.
it's
And
hard.
that's the challenge, that like, and I'm not saying that's a flawed system. I just think it doesn't, at the end of the day, it doesn't allow the athletes to really thrive in the whole developmental process. So,
Yep. Yeah, and as you said, like the longer somebody goes through from an initial injury, something acute, or post-op, like from week to week, every week, there's more and more that they need to be doing. And like you said, that's just more time.
yeah,
And that's then taking resources away from me, where a lot of times early on, it's like, okay, like remember all those band exercises you used to do? Okay, we're gonna start doing those again. So like, let's go over those real quick. Let's make sure you got those. This is your intro back to like early stage arm care. And arm care is its own thing that needs to be defined, I think, more globally. But like those early on things, like how to do those, we're gonna do them. Cool. I don't have time to do those with you every day, nor do I want to, because like they're mind numbing for me. But I just need to make sure you know how to do those. You're gonna do them safely, and you're just gonna run with those, because we have to spend more time with other things.
yeah,
And then that's where, like, if somebody's not working with you, I just kind of have to trust that they're doing certain things. And the longer and longer that their rehab goes, I'm then assuming more and more is being done without my supervision.
yeah.
Unless the athlete's like, yeah, I'll spend 5 days a week with you. Like that's not happening.
realistic,
Like, that's not
yeah.
realistic. Everybody's busy. Everybody's got a lot of stuff going on, and there's also insurance situation that might kind of dictate how many times people can see me. We try and spread it out as much as we can, and then the more that I can not do with somebody and have someone like you supervise, oh my God, it makes my life so much easier, and I don't then have to worry that a kid's going to go and do kind of whatever they feel is good that day, versus like, this is your program and this is what we're going to follow.
Yeah. Yeah. I mean, it's invaluable, I think. And I think that's ultimately why we decided to kind of work together and collaborate. And I think it's definitely, the athletes have improved immensely from it. So,
Need a cough button on that thing.
yeah, we do. So you've been, working with a ton of Tommy Johns and just, I mean, call it elbow injuries in the last, I would say,
More than anything.
maybe in the last 2 years, I've personally seen a huge influx.
Yes.
And I'd say easily over 50% of the kids that you're working with currently are at some stage of the game post-op Tommy John.
Yeah. Just this year, 2023, I've had from the beginning, like, from January, I think I've had 17 or maybe 16 or 7. Either way, like it's still a lot.
Yeah.
One is too many, and they're going to happen. So we're here to deal with them. But 17, and also too, like sometimes I'm like thinking, maybe there's a similar number. I'm just here longer, and there's more word of mouth, and people know me more, and surgeons know me more. So then maybe I'm just getting more of them.
Yeah.
But we also just see that they are happening more.
Yep.
Whether it's a surgery or just a lower level sprain of the UCL or PRP injection or whatever it is, they're definitely happening a lot, and I would definitely say they're
Increasing.
like I'm trying to think of the number. Probably like 50%, maybe more I'd say more than 50% of my caseload is some sort of UCL injury.
Related. Yeah.
It's the most common injury in baseball, so it kind of makes sense. But yeah.
Yeah. And you kind of touched on it earlier about like you like to do certain things and hit certain like landmarks or like checkpoints, so to speak.
Yeah.
Within the like the acute earlier stages of like post-op. Walk us through like what are those landmarks? What are those checkpoints that you're trying to hit with kids? Whether it be like leading up to them, they're hitting their throwing program, leading up to training? Like walk us through some of those things that you're trying to like check off.
Yeah, they'll vary too. They'll vary depending on the surgeon, my relationship with the surgeon, my relationship with the athlete, and then obviously which surgery they had, or if it was non-surgical, did they have PRP or not? Yeah, I mean, it's easy to say it depends, and there's so many variables that go into it, but and there are, but just to give you kind of off the top of my head a reconstruction, I'd say so. The fastest I've seen full range of motion has been like 10 to 12 days, generally speaking. Full range of motion with the elbow, like elbow extension. Flexion takes usually a little bit longer just because we don't have to kind of chase it as much, but it'll happen over time. But yeah, that extension, it's like the fastest ones are 10 to 12 days. And then I've had ones that have taken, in my eyes, like way too long. That, maybe there were factors given to the athlete or different sort of guardrails that were given to the athlete that may have caused it to take that long to get full range of motion at 8 weeks, 9 weeks, 10 weeks. And those are the ones that keep me up at night because I just want these kids to do so well and kind of hit they're expecting to throw day one on this week. And I want to be able to provide that. And if I don't, then I'm like, damn, like I feel like I failed them. And a lot of times maybe, it might not be because of me per se. I feel like I am doing all of the things that I normally do with the same kids. So why aren't they working? And there's a lot of factors, but yeah, that early elbow extension is the number one thing we're chasing, other than, not causing more problems, right? Like these elbows are kind of jacked up when they show up day one. They're usually a week post-op when I first see them, so they're still inflamed. Some solid bruising all over the elbow, tricep. They might have steri strips over their scars, whether they're on the forearm or just on the elbow. I'm just trying not to mess with any of that stuff early on as much as possible and just kind of like let that process happen while chasing pain-free range of motion. And chasing doesn't mean I'm pushing through. As I said, it has to be pain-free. So everything should be, I think kids are usually, or I should say athletes are usually surprised at how much rehab doesn't hurt or it doesn't really bother them. Even the surgery, sometimes they'll come in and that's my first question. Like, it wasn't as bad as you thought it would be. And they tend to kind of agree. So that early range of motion is huge. And getting the brace off, cough button, getting the brace off and like just moving it, because the brace, like, yes, you have to keep it on for certain situations, like leaving the house and sleeping, and makes plenty of sense. And I tell kids to do that. But you also need to take it off because the thing makes you even stiffer than you really should be. And that's a 6-week process that you're wearing that brace for typically. And then, yeah, once I feel like, the bruising is down, their incisions are clean, they're dry, they're clear, their range of motion is getting better, then I'm going to start doing more. So backtracking a little bit, to get that range of motion, they're doing things like isometrics and ranges of motion that are completely pain-free. Simple things with their hand. Actually tell kids to play video games. Parents might not like that, but just to keep them using their fingers and wrists a little bit. And then, yeah, full range of motion. And even without full range of motion, I'm still going to be doing things like just getting them to move their arm with a light tubing, light band, like the orange or pink one that I have in my office. And it's just range of motion with the slightest load that they feel like they're doing an exercise, and just getting them to move it. They're like, oh, actually, this is not that bad. It actually feels good when I do stuff. And that's always kind of a nice positive reinforcement for them, where the more that they're using it, the more exercises that they're doing, they typically notice that it feels good and it feels better. And I tell these kids, like, do it twice a day, do it 3 times a day, do it as much as you want. You should just continue to feel good every time you're doing it. And then I would say, like, typically, again, depends on the athlete and how long we've both known the athlete. If it's somebody who's new to both of us, we might be more hesitant to get them back into what they've already been doing from a strength and conditioning standpoint. But for somebody who has been training here, I'm just thinking of one in particular that trained with you guys for years. Um,
So
you're good. Pitched in college, still pitches in college, had Tommy John, and he was back training with you guys, I want to say 2 weeks post-op. And again, he's not just throwing a bunch of weight on his back and doing dumb stuff. He's doing what he has available to him. So I can kind of dictate what's happening there. And we have weight vests, we have chains, we have different ways to load people. Um, and then I would say normally they're probably going to start training with you guys. You okay? Normally they're going to start training with you guys probably around like week 4. Things have calmed down. The healing process has, you know, that 6 week mark is kind of like a nice checkpoint to get to where they're getting their brace off. Everything feels a lot more normal throughout the day. They can kind of lift things and not really, remember that they even had the surgery. So that like 4 to 6 week window is when they're kind of, in my eyes, they should be with you guys for sure. Um, and it's very simple stuff. Like I probably won't have them doing like they're not doing anything deadlifting wise, like picking anything heavy up off the floor. And I kind of use what their like loaded carries are or what their rows are with a cable or a dumbbell to kind of dictate when they're ready to deadlift or do something that's more loaded in their arm. And deadlifting, so like picking up 95 pounds off the floor is day one for deadlifting. Like it's not 315. So it might, again, people might picture something egregious, but it's low level. And if you can pick 45 pounds up off the floor, then you should be able to pick, 90, 95 pounds up off the floor as well. You gonna cough again? Yeah.
what's going on?
Getting attacked
My
over
apologies.
there. Up late at the Jets game last night.
Yeah.
But yeah, so like those early weeks, early weeks, just range of motion. It's super simple stuff. Do a ton of manual work, tissue work. Get to know like the rest of the kid's body as well. Get them like, let's move your hips around and like, let's see, you know, explain why things are connected and how everything matters and give them solutions for other things that maybe were the quote unquote cause. Like if you can't rotate your trunk or your hips and like you just can't use your body as well. Those are things that we can start kind of trying to chip away and make it just part of their normal routine that they are doing these certain corrective like mobility work things that then you guys take and throw into your strength programs. Um, but then yeah, so if it's a reconstruction, they're going to be throwing around like week 18 um, most commonly. So then backtracking from there, they got to do single arm plyos, they got to do double arm plyos intensively, they have to do double arm plyos extensively. So that right there, that's 6 weeks. So you're getting back to week 12, and then from week 6 to 12 is it's kind of a boring like autopilot mode where you're just starting to kind of get back into all the strength conditioning work, introducing a lot of the different variations of pushing and pulling, and just slowly adding a little bit of weight each week, 5-10 pounds. It's not a lot. But yeah, I think that's kind of generally enough information for this talk. We could always talk more about it though.
Yeah, I mean it's definitely a process, and I think I would imagine as you've done it more and worked with more athletes, like there's iterations
Yeah,
to a little bit of an extent,
for
right?
sure.
Like, but I think at the end of the day, like there's, and you touched on it, it's somewhat dependent upon the surgeon and your relationship with that surgeon and
Yeah.
how aggressive you can or can't be.
Yeah, and some kids I'm going through their process and I'm like, man, like I want to do more with this kid. He's ready, he's doing awesome. I'm thinking about one in particular right now and like I would have him throw in week 14 if it were up to me because he's doing so
Yeah.
well. And it's not that I'm trying to push everyone to like throw earlier, throw sooner, let's get back on the mound. Like that's also not the goal. It's a matter of like we can we can continue to just develop different physiological qualities. If we can introduce throwing earlier, maybe they have less apprehension when they do get to the mound. Like that's important. And their trust in their arm might be the most important thing compared to anything that I do with them. So I'm almost just trying to introduce things as quickly as I can at a low level for them to just trust the process and realize that they are okay.
Yeah.
And even just like ranging them slowly back into layback and external rotation of the shoulder. Like the first time I do that with kids, they're like really hesitant, which makes plenty of sense. Like they know that's a bad spot to be in for the UCL if it's hurt or if there's pain or whatever. So they have those beliefs, and I'm just trying to show them that things are fine and they will be okay. So I'm doing those things early on. I'm not day one, but I'm doing those things early on just to show them and expose them to these different positions and stressors that can then just move the needle sooner, so that when they get to throwing, that first day of throwing looks really good and it looks normal, as opposed to, you know, like some kids, if it takes their range of motion forever to come back, and whatever, two arm plyos didn't go well, or single arm plyos are like, they're hesitant. I'm like, okay, is this kid gonna be okay? Like, and then he'll be fine. It's just a matter of,
Yeah.
that's the kid that I'm like, hey, how was throwing yesterday? And I'm like, gonna hold my breath for a second. Like, I really, I think they're gonna be fine. If I didn't think somebody was gonna be fine, I wouldn't recommend they throw. I would, refer back to the surgeon for some help. But the ones that I want to just push and get them to throw those are the easy ones. And I'm often kind of bored with their rehab because they're doing so well, and it's just like, man, we can't do anything new yet. It's just too soon. And
Yeah.
just keep rinsing and repeat and just keep getting stronger.
Yeah, I mean, there's obviously like you can't speed up physiology and like biology and all that stuff. And so getting them to understand like, look, there's opportunities where we feel like we can push you, and start to integrate some more like advanced stuff. But there's certain things that like we just can't rush biology. And so like
Yeah.
I think you really do a good job of kind of towing the line of like, hey, these are the things we can push, maybe level up from an intensity standpoint, but these are the things we got to stay the course here.
Yeah. And I'm
So,
always doing like a little less than I think they can do, which is
yeah.
smart rehab,
Yeah.
right?
Yeah. I
Like,
think,
'cause once they don't feel good, then you've done something wrong.
yeah. And
Um,
that's a challenging, place to be in, as someone who's been through the
Couple times.
gone through it twice. It's, mentally it does play a big toll on you. And,
Yeah.
some of these kids, they almost become like borderline hypochondriacs. And I think that's essentially what you're saying is you're trying to avoid that, is try to get them to understand like, look, you're not as fragile as you think, despite what you just went through.
Right.
You're gonna be fine, but like kind of working through that transition so that like you're capitalizing on the time that you're spending with them, and
Mm-hmm.
if there's opportunities like you said where we can push, let's by all means do it, because I think
Yeah.
that's for the psyche of the athlete, that's such an important part of the process.
Right.
um
Yeah. And then like the other, on the flip side, like we have a lot of time too. So like it's okay if something is late, like late in terms of like what I would expect or be normal. If it happens a week later, that's also okay. And maybe we have to push throwing back a week or two. That's also okay. Sometimes that's also dependent on when they have their follow up with their surgeon, who then clears them to throw. Depends on the surgeon. Some surgeons are comfortable with me kind of making that decision from afar, or just kind of checking in with them over the phone or through text. But some surgeons who I don't have a working relationship with actively, regularly, then I'm not even going to try and get the kid to throw, because
hmm
I don't want to step on those toes that I don't kind of have a relationship with yet. And that's fine. But yeah, like the good thing is too, like if something does take longer, that's also fine, because they got a year, like they got plenty of time. And
yeah.
um, the throwing programs are long enough, like those are mind numbing as well. And there's plenty of time to kind of keep working on things. But I do think the ones that do the best are the ones that earlier on we can just start doing a little bit more, and just get them to trust it, and get them back to what they're normally doing, and kind of feeling like they're doing what they have to be doing.
Yeah. So given the high number of Tommy Johns and elbow injuries that you've worked with over the last several years, what are some things that,
I think it's like over 50 in the last
yeah, it's easily
4 or 5 years. Yeah.
easily. What are some of the things that like you like maybe early on in your like working with this population, what are some of the things you believe to be true that maybe you think a little bit differently about now?
Um, so I mean, so as a physical therapist, when you're early on dealing with an injury that you might not have dealt with too much before, like you're just gonna err on the side of caution. Like that's very normal. And that's, I think, what happens a lot of times if I get an athlete later on in their rehab process, where maybe they've already started throwing, or maybe they're 6 weeks in and they want to mix it up and they start working with me a little later on. Um, sometimes I think it's just the physical therapist they had before just doesn't really see these often, because you really don't. Like, most physical therapists will never see a Tommy John in their career. It's like not that common. As common as it is, it's not that common compared to ACLs. They're all over the place, right? We see them on TV every day. Somebody else has torn their ACL, unfortunately. Um, and so I think the comfort level of working with the injury just depends on like how many you get to see, and then how many different kind of protocols you see, what things you've done and your experience. And it's like I get one protocol that's drastically different than another, and I've been following that other one so much, like why, and that works for the same surgery, nothing's different. Like I feel more like I can kind of adjust and change some things. Like I don't need to wait as long to do certain things, let's say. And I feel like the more I've done it, the more comfortable I am, and I don't feel like I'm going to hurt people. Because that's the worst case scenario: is you re-injure somebody, you break a surgery that's fresh. Like that's number one rule in PT, right? You don't want to do that. So I think, and that's what I do think early on. Like you're very hesitant, or you're very soft with kind of your recommendations, and you're not confident as much, or you're super careful with the arm itself, as opposed to now I'm like, you're not going to hurt this. You're going to bang it on the wall one day. You're going to hit it on the corner of the table. Like, don't worry, you're fine. Take the brace off, move it a little bit, put it back on. Like, I kind of give kids confidence early on. And I think that's probably the most important thing, is like, you're going to be okay. You're not going to, like, as long as I've had kids also fall down the stairs like 2 days after surgery because they had, the hamstring graft or whatever. And it's like their leg just kind of gives out, that's scary for me. But yeah, I think it's more about like providing the confidence, I think, is probably like the most important thing that we can do. Because there's also kids that go through entire rehabs and they haven't done anything that I would particularly think is useful or like to do, and they wind up being okay. And then it's like, okay, well, shit, am I that important to this rehab for this individual if they could then do like next to nothing and still be quote unquote okay? So that's where it's like a mix for me of like, does this matter? Does it matter? And I think as long as you're doing a lot of the basic things well, and you're getting stronger, you're addressing range of motion deficits, mainly in the shoulder, and then trickle down to the rib cage and pelvis and everything there. Those are the most important, in order, I think, most important, because then they're just less important the further from the injury. Mm-hmm. Still important for us, but I think that's probably what I think it is the most, is that's changed, is like what matters. Or a lot of times I have one athlete who's always just jokes. He'll ask me a question and say, doesn't matter, does it? And I'll say, no, it doesn't really matter. But yeah, no, I think a lot of like the lower level exercises, sometimes people get hung up on, like, which band exercises to do, or which, like, eyes wise tees, like which kind of lighter dumbbell exercise to do. For me, like, for the most part, I don't really care. It's more like that you are doing something, and you might do them this way versus this way or this way. And those are the things I think matter less, that over time has kind of shifted and changed, because eventually, like, this isn't going to save your UCL, right? Like, you need an entire program that's going to be supplied by someone like Mickey, who's going to incorporate things like this at a higher level in different positions, on top of just total body strength and power development. That's what's going to, what our attempt is going to be at stopping these from happening. Arm care is a total body approach for us. And yeah, I don't know. I don't really know what else has changed too much. More so that I think just things don't matter as much as they maybe used to, or they do when you first start seeing these things.
Yeah.
That makes sense.
That kind of like blends into my next question, because I think you, in some capacity, you touched on it in a bunch of different ways. But, from a strength and conditioning standpoint, like, our job is to get these athletes to be able to withstand like stressful situations, right? Like, they need to be able to accumulate stress, their tissue, all of their, from a just overall strength and physiology standpoint. Walk us through movement is kind of like the foundation of all that, right? Like you had mentioned, making sure like the shoulder down to the thorax, the rib cage, the pelvis, and all that, how that moves. You even said arm care is like a full body thing.
Right.
So, considering that movement is kind of that foundation, what are some of the big key indicators that you're looking at? Whether it's a post-op or whether it's just the kid who's got inflammation or pain through throwing, through your assessment process, like what movement capacities or things are you looking for athletes to be able to do? Like, hey, you need to be able to do this, this, and this, and be pain-free. Like, what are those things that you're really addressing and looking at in the assessment process?
Yeah, and the assessment process, I mean, again, it's like the more that you do this stuff, like it feels like the less you need to assess certain things, and you kind of already know what's happening. But I'm still going to use my assessment to kind of dictate what I'm going to do or what I'm going to tell somebody to do. But from like a range of motion standpoint, like my go-tos, like day one with somebody who, I know I'm probably going to see them again, right? Like most of the time it's not a one and done situation. So I don't need to kind of like tease out every fine little thing. And I think sometimes if you're doing that stuff very early on, you might be wasting your time with the minutia versus like, well, if their hip doesn't rotate, who cares about their foot or their ankle at this point in time? Because I know I'm going to have some time with this person, especially if it's post-op and they're here for a couple months. Like, I know that I can chip away at this stuff. So like, let's just make sure we get the surgery under control, dealing with that, and then trickling down from that. If it's an elbow surgery, like we're alluding to, I'm probably not assessing day one shoulder range of motion. I'm going to talk to them about it. Like, hey, are you one of those guys that you would always just be super tight here? Or like, did you have a lot of layback? And a lot of times they already know. They're like, yeah, no, I've never had this before. And it's like, okay, I already kind of know what I'm going to have to give them eventually. But that might also be something that's from the shoulder might be dictated by the rib cage. So having enough trunk rotation towards that side for me is a big deal. Just from like a PNF standpoint, like you need to rotate this way, and then supinate. So those things kind of go together. So just globally, day one, it's like, can you touch your toes? Cool. Can you rotate your trunk and it's like 90 degrees from where you started and it's half and half from your hips and your thorax? Cool. Can you do that both ways? Awesome. And then it's like the longer it goes on, then we can talk about like shifting your hip and seeing if you can kind of rotate the other way. Because that's then like separation, and we can kind of assume some things, but also at the same time, like we're still going to give a lot of these guys the same stuff because they all need to be able to do the same stuff. So we're going to be giving them a lot of things that they, maybe they'll be doing more windmills in their warm up if they have a separation issue or whatever. But at the same time, like the guy next to them might also be doing windmills, so maybe they don't need to do it as much, but they're still doing it because it's part of what they need to be able to do.
Yeah,
at a higher level.
As a thrower, they're all going to be they're all going to be exposed to the same type of stresses.
Right.
How their body assumes and adapts to those stresses is slightly different, and so some of that stuff that you'd be giving them is a little bit different. But
right, and then going into like the further from the spine or the core, further from the center of the body that something is, I think in general, the more like hands-on, more manual work that body part needs. Like if your finger's messed up, I'm not doing something with your rib cage to make it change, as opposed to like your shoulder, I could change your shoulder by changing your rib cage. So those leaps of joint interdependence, I think, are less and less important the further from the center of the body something is. So if we're talking about an elbow, it's, maybe the shoulder is the cause of the elbow. If they have a lack of layback, that's going to stress the UCL more. We know that. But there's also situations, there's plenty of kids who tear their UCL and they have plenty of shoulder range of motion. So maybe there's something more local here where they have a lack of supination that, that's not going to be caused by their hips. It's going to be something more local that I need to work with, while at the same time addressing or making sure, kind of clearing out that nothing else is limiting that. But I think that answers your question.
Yeah.
I do that a lot, I think that answers your question.
Yeah, I mean, I think at the end of the day, like the biggest takeaway for me is, and you address that, is that like movement is something that like you kind of work addressing those issues from like the middle out, right?
Yeah. Yep.
And often issues that are happening at the extremity sometimes are, you know, something that happens like further up the chain that essentially there's an inefficiency or
Right.
lack of stability or motor control, whether it's, doesn't matter. Like you're kind of addressing that stuff first.
Yeah, and I'm not going to go look at like your big toe extension day one. Like
Yeah.
unless you're here for a foot thing or, which
sure.
I'm probably not even dealing with because that's
Yeah.
somebody else's job at this point. But I'm usually not even looking at that stuff typically ever. And I think it's just a lot of times because if you deal with the other more central things or more in the middle things, they kind of clear out anything going outwards from there. So I feel like if you kind of focus, like if you look for something wrong with somebody's body, like you're gonna find stuff, and it's just a matter of whether or not it matters or if it's worth my time to kind of make it a problem that they need to fix. Like some problems don't need fixing because they're actually fine and they're functional and they can be dealt with, and still the athlete can still be successful with what they do.
Yeah. Last question, and I think you kind of touched is like I think understanding those nuances is really important. And I think at the end of the day, the way you approach your PT, like just in the model that you guys have here, is I think one of the main differentiators that allows you guys to operate in the way that you do, rather than your big box PT. Kids come in, and we've seen scenarios where kids have come to us by way of those situations and are often behind because for a lot of the reasons we discussed earlier, like there's no individualization to their evolution and development through that process. It's just, well, we're going to do this on this date because this is what the protocol says, and this is what we did with the last person. Walk us through why you think that is so important in this whole, and that's the 30,000 foot view, like not getting into the weeds with what they're doing, but how we're doing it.
Yeah. And that's like, if you took me and put me in kind of a traditional physical therapy clinic, like seeing 4 patients an hour, 5 patients an hour, like I'm not going to be as effective either. So it's not even usually to the fault of the individual therapist. It's kind of a bigger, broader systemic issue. But I think that is what I think differentiates us most. Like we don't have assistants here. We don't have kind of the standard, college kid getting, $15 an hour to kind of make sure that you're going through your exercise sheet as an aide in the PT clinic. And we don't want to do that. We want to provide the highest level service we can, as individualized as it needs to be, and then be able to spend time with people so that we can make those progressions and we can do them on a timely basis and not let them fall through the cracks. And then, at the same time, like if somebody comes in from a different clinic and that clinician, like I said, maybe that's the first Tommy John they've ever had because it's not as common as an ACL. So, it's to no fault of their own. They might be limited by the model that they're in. But I think that is what makes us different, right? Is we can provide that level of attention, and because we can be one-on-one with them, I don't think we need to see people as frequently. Like it's not just the standard Monday, Wednesday, Friday till the end of time. It's kind of, well, I don't think at this point in time you really need to see me. And I think parents are often kind of surprised when a kid comes in day one, post-op Tommy John. I'm like, I don't want to see you again for another week, and they're like, what do you mean? Like, you just had surgery. It's like, no, I'd rather let's save our time for when we really need it.
Yeah.
Right now you can't really do too much, so I don't need to watch you do elbow isometrics and play video games. But that's where I think we can kind of budget our time, and we are so one-on-one that we can see people actually less frequently and make it more of a heavy dose of this is individualized for you, so you're going to benefit as much as you can. And then we can give you support through email with a list of exercises that have videos, and not everything needs to be, like I said, with bands. I don't need to watch you do band work 3 days a week. That's just not, that's not medically necessary, which is always a strange term that is used in our field. But and I think that's sometimes what is happening at other places is there's no bandwidth for individualization. So it's that's a baseball kid. He's going to do some band work because I got this other patient and that one that are not baseball players and, whatever it is. And that kid winds up just doing Monday, Wednesday, Friday, just doing band work at their PT visit and not getting the hands-on, the manual, and the progressions that they're needed.
Yeah. Well, I think for all those reasons you listed and just your overall skill set as clinicians, like I have always had the utmost confidence when we send athletes over to you guys.
Same.
Um, so appreciate all the work that you do for our athletes, and you know,
Likewise.
not to mention, I think having you guys uh, on our team, so to speak, it allows us as coaches to continue to level up. I think the feeling is mutual, both from both sides of the curve. But yeah, it's been a great relationship with you guys, and I think it's something that we're going to continue to build upon, and hopefully at the end of the day, which is most important to you and myself and the Annex and Resilient, is how can we serve the athletes better? How can we create favorable outcomes for them long term?
Yeah.
So
Yeah, and there's definitely there's a need for places like Resilient or places like the Annex for people in our profession. Like the professionals that value what we're doing are the ones that we want to come help us and be on our team. And those are the ones that they can see the difference, they understand the difference, and those are the ones that then can catapult their careers and do more with their degrees or with their licenses or whatever it is. And then it's just a matter of then they just enjoy their job more.
yeah,
If you were forced me to go work in a traditional PT clinic right now, I don't know that I would be a PT anymore. I might not.
Yeah.
I might just leave and do something totally different. And I don't think I could do that. But that's just me. But yeah, I think we're trying to do some stuff with force plate testing more, and we have the force plates here, and we're again trying to kind of audit our processes and see what things are important, and also what do we're working with a lot of baseball players. What are the organizations that they're trying to play for, whether it's collegiately or professionally? What do those organizations value, and how can we kind of support that in-house and provide them with what they think the athlete needs? Sometimes it doesn't always jive with what we think, but if we can kind of support that while also giving kids what we think is important, that's going to be a huge victory for us in building our relationship with teams and organizations. And then, we're writing a return to play book, a return to sport book with everything from lower body to UCLs. I've got the whole throwing section. It's supposed to be kind of a broad strokes thing, which is hard.
Yeah.
It's easy and hard. I know that what I'm putting into it related to throwing is it's watered down, but it's also this is the big rock thing that we need, and that's always what we're trying to focus on here. What are the biggest rocks, and then we'll fill in the cracks with all the specific things after that.
Yeah. We'll love it. Appreciate your time today.
Yours too. Thank you.
Apologies for the coughing fits halfway through there, but we made it.
I'm going for sure.
If people want to utilize working with you or just see more stuff that you guys are doing, how do they kind of reach out or utilize your services?
Yeah, Resilient. So from a patient treatment standpoint, resilientperformance.com. We just had a new website built to kind of make Google happy, make the internet happy, because we found that that's probably more important is to impacting people's lives is just getting people to show up.
Yeah.
So we had somebody professionally make us a brand new website that kind of jives with search engine optimization and stuff. So that's all resilientperformance.com. You can submit your insurance information, and then we get the emails on the back end and kind of coordinate all that stuff. And then if you are one of us, if you're a professional like us, and we do have some online courses and different kind of pieces of content, that would be edu.resilientperformance.com, and that's our old website that you can log on and get some coursework on there and kind of learn a little bit more about what those bigger rocks are for us. We have 2 online courses there and some other different kind of PDFs that you can pick up here and there. But and then social media, we do that whole song and dance with posts every now and then about things that we like and think are important. Resilient PPT on Instagram. And then I think it's the same on the YouTube handle is also Resilient PPT. We've got 700 exercise videos on there or something nuts like that. But always just trying to put stuff out there and capture more people that like what we're doing.
For sure. And I'll be sure to link all that stuff.
Thank you.
when I produce all this stuff in the show notes. So
Awesome. You got a nice setup here. I like it.
yeah, hopefully we'll keep growing, and luckily we have guys like you to interview, and as long as people get value out of it, that's the most important thing. So appreciate it.
Awesome. Thank you.
All right.